In terms of the techniques, which I mentioned is the second component, what goes hand in hand with the spirit, these are the techniques that we would cover in a 2-day introductory training. You could expect to learn about the opening skills, which we refer to as ORs. So that's the first 4 that you see listed here: open-ended questions, affirmations, reflections, and summaries. We also incorporate and talk about how to use the stages of change model in relation to motivational interviewing. We cover concrete skills for rolling with resistance and practice those. We also offer a technique for sharing information, resources, or even concerns that you may have about your patient's plan of action or your client's plan of action, and that's called elicit, provide, elicit. So it's an MI adherent way to share those things that is still empowering for the person, and we avoid getting into that lecture mode. So that's a wonderful skill. We also focus a great deal on what we call change talk, and we talk about why it's so important, how to evoke more of it, and how that impacts actually increasing your client's commitment to change. And it really is, like I mentioned before, the combination of understanding the spirit and operating out of that spirit and combining it with the techniques that make MI effective. So in considering if motivational interviewing is right for you or your organization, and as you think about this, the theoretical aspect of it, I'd like you to consider, since you've gotten a taste for this so far, to what degree is your current approach or the way that you choose to work with people or the way that your agency views working with the client or the patient, and does it seem compatible? Now I want to move into more of the practical concerns and how this would fit in for you, and when and where motivational interviewing can be used. So we've seen it be effective as a prelude to treatment. So before beginning regular treatment, you could have 1 or 2 or 3 sessions focused primarily on utilizing motivational interviewing. We've also seen it in combination with other approaches like cognitive behavioral therapy. It's a really good fit for CBT. And finally, motivational interviewing can be used throughout treatment for different clinical issues like depression or anxiety. In terms of who can be trained or the types of professionals who have been trained, it's really, as I mentioned, it started in the addictions field, so you see addictions counselors listed here. It's also spread into so many other areas. So we see it with mental health counselors, being used by mental health counselors. It is moving more and more into the criminal justice system, so probation officers. We've also seen it move into the healthcare field. So physicians, nurses, health educators, dietitians have really taken to motivational interviewing and began integrating it into their practice more and more. A few other things to consider as you think about seeking training in motivational interviewing. Miller wrote about, in terms of a professional who's going to be trained, one of the most critical aspects of the person being successful in utilizing MI, the number one thing seems to be not necessarily their training background and what they studied or what their background entails, but more so if they have the ability to empathize with the person sitting in front of them. Another thing to consider is that some people may describe or may think of motivational interviewing as easily administered or a very simple set of counseling techniques. However, Miller and Rolnick emphasize that it is a skilled counseling style, and it does require a considerable amount of training and practice to be able to use it effectively. And another draw for you might be that more and more grants are asking for evidence-based practices. And motivational interviewing, if you do feel like it's a fit for you and or your agency, if you are seeking a grant and it asks for an evidence-based practice, MI could be a solution for that. And one last thing I would mention here is something that practitioners have talked about. It hasn't been conclusively researched as of yet, but one thing people really start to talk about and get excited about is that motivational interviewing seems to help them with burnout. It seems to help in decreasing burnout. So I know that was an appeal for me as a counselor coming to this approach and beginning to use it with my clients. And I've heard from in every training I've done, I've heard people start to talk about that and get excited and feel like a weight is lifted. Part of motivational interviewing in working with people in this way is beginning to shift who is accountable for the change. So practitioners are drawn to it because it shifts the accountability to the person themselves, and it really is up to them what they choose to do. As you consider what would be involved in learning motivational interviewing, I wanted to point this out. Miller and Moyers wrote an article and really outlined these 8 stages of learning motivational interviewing. And they include the spirit, which is the foundation. I mentioned the ORs, which are the opening skills, focusing on change talk and how to evoke it and reinforce it. Also, the concrete skills for rolling with resistance, being able to develop a change plan, really seeking to consolidate commitment from your client, and then finally being able to take motivational interviewing and integrate it into other approaches that you might be using. And as you look at this list, I'm wondering which one interests you the most, or maybe a few of them really draw your interest or your attention. And we touch on each of these topics in our 2-day intensive, and of course, we touch on them more extensively in our advanced level training. If you feel like motivational interviewing is a fit for you and you want to look for training, you're interested in putting forth that investment in your own ability to work with people in this empowering way, these are the things I would encourage you to look for in any training that you seek. Of course, I hope that you can join us for a training, but any training that you choose, this is what to look for in terms of a quality MI training. So the first thing I have here is a MINT trainer. So MINT is the Motivational Interviewing Network of Trainers, and that is basically the closest thing that exists to a certification for a trainer. Also, a standard introductory training is 2 days long, so at least having 2 days to begin your study of this approach. Ideally, having a small group in a classroom setting is good, and then looking for a continuum of learning tools. So getting that initial training, having an opportunity to maybe be able to submit tapes. That's something we offer as well, where you can take your initial training, go back into your practice, get permission to tape some of your sessions or some of your meetings with your clients, be able to get some feedback on those tapes and get one-on-one coaching, and then also continue your training. So what we find is that getting refresher trainings, we offer things like webinars, we offer advanced level training, but just making sure wherever you are that you really have an ability to take advantage of a continuum of learning tools. A few other things I would put out there, another study that was done over the past few years that was done on the training of motivational interviewing. It was a systematic review done in 2008. And what they found is that immediately following a training, the skills of the practitioner were enhanced. But what they found is that over time, if they didn't take advantage of, or they didn't have the opportunity to continue their learning or get one-on-one coaching and support, that it was harder to maintain, and you know, their ability to practice was more limited. So again, that's why I would encourage you to set yourself up to have a wonderful initial training, and then have the ability to get those tools that you need to continue getting support. And so as you think about adopting motivational interviewing and the different theoretical issues and the practical concerns that we've talked about, I'm wondering, which do you feel like would be more challenging? Would it be theoretical concerns and lining up with those things, or would it be more on the practical side? And I'm wondering, you know, whichever seems more challenging, what any possible solutions might be. In other words, how could you overcome anything that might be holding you back right now from getting the training you need to practice this really empowering approach with your clients? And finally, I want to offer you, as you continue to think about this, and if you would like more information on motivational interviewing, I want to offer you a few resources that could be very helpful. One is the MIT website, and they have a number of tools. They have a library. They have a number of resources listed there. Also, the CASA website out of New Mexico. And then I've also listed, there is a motivational interviewing series of books on different populations, on using MI with different populations. And so I have those listed here for you as well. So I'm going to give you a few seconds to write those down, and I hope they offer you more information. And of course, please feel free to contact me or contact MI Training Today at any time if there are any other resources that you need. So I'm going to give you a few seconds to write those down.
Thanks, Katie. If you feel like the spirit of motivational interviewing that Katie covered today is in line with the way you want to work with your clients or patients, and if the techniques intrigue you, we highly encourage you to come to our Motivational Interviewing 2-day intensive. Here is what you can expect to walk away with. You'll receive a comprehensive introduction to the strategies, principles, and techniques of MI, including rolling with resistance and the spirit of motivational interviewing. It is a dynamic presentation with video clips, demonstrations, and role plays. You'll receive a training manual and 14 CEUs upon completion. Our main goal of the 2-day intensive is for you to walk away from the training with MI skills that you can use with your clients immediately. We hope you'll be able to join us for a future training.
Thank you for joining us for this webinar. And if you remember just one thing, remember this. If you're willing to take advantage of it, MI can offer you an empowering, effective, and not to mention an enjoyable way of working with your clients.